Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good morning and welcome to Filibusters in Fine Print, AMJ's public policy podcast. I'm here with the AMJ policy experts. Why don't you all say hello? And we're going to go to the right this time, as Daryl looks expectantly to be called first.
Jamie Miller, Ambassador of Goodwill here at AMJ.
Alicia Sawyer, Government Relations Assistant.
Hi, Daryl Drevna, Senior Director of Regulatory Affairs.
Outstanding. And today we are missing Lauren Latney. Hope you come back soon. We need you back because you basically are the glue that holds this team together, apparently.
Please bring us some Crystal cheeseburgers from Nashville. Thank you. The small ones,
I know
like White Castle. Oh,
I lived in Knoxville, Tennessee.
Chicken,
for a long
did you
time.
really?
Chicken
I grew
sandwiches
up in
are good,
Knoxville.
Was it nice?
Yeah.
We have members in Knoxville.
It's the entire city. So yeah.
Yeah. Well, it's hard because my family is originally from Pittsburgh, and then Pittsburgh and Knoxville are two very different places. So it was a bit of a culture shock.
All right.
Yeah. But Crystal Burger. So
Crystal,
you know.
oh yeah, and if you go to New Orleans, they have one on Bourbon Street, and you get the little the chicken sandwiches. Oh, they're delicious.
And what are the candies in Nashville?
Candies?
Yeah, I brought some for my dad.
Like turtles? No.
Nah, it could be.
Seas?
I don't know. Okay, very good. So today we're going to talk about the government shutdown. And it's pretty exciting. So Jamie, so for those of you who listen to our podcast, you know that Daryl provides 3 to 4 to 5 page outlines. Everything is highlighted as to whom speaks and what they say. Jamie is doing this today. And
I prefer crayon.
Crayon is about right. There's
Well, if you look at Jamie's
basically
outline,
says
he has highlights.
podcast.
So we're trying to get some structure out of this, and it just has introduction and then sort of blank stuff. So anyway, all right, let's.
It's like the shutdown. Everything just
Fill it
came to
out,
a halt.
Yeah, right. All right. So, no, here's helpful. What is the government shutdown? And apparently, quick explainer. I guess that's directed at me. So
...
And government shutdown is when the federal government runs out of money. And once it runs out of money, because Congress hasn't appropriated that money, it literally shuts down. And important things like federal employees don't get paid. That includes my sister and brother-in-law. Air traffic controllers don't get paid, which is a very big deal. Same with TSA. And if you're in D.C. during government shutdown, it means you don't get to see the Smithsonian because all those museums shut down. And if you're in the West, as do those federal parks like Yellowstone, et cetera.
Or if you want a passport for your child, which I was trying to do, you can't get one.
He's 3 months old.
Where are you taking him?
Away from this country. But yeah, you can't get a passport.
Oh, here we go. our resident Republican
Yeah.
right here. All right. And one of the other questions that Jamie has given to me is, why is healthcare particularly vulnerable during government shutdown? The answer is two. One, and then, okay, one, the federal government funds much of healthcare in this country, and two, many extenders expire when the government shuts down as well. So we're going to talk about the government shutdown, and here we go. So, Chet, this is back to me. Why did this happen? Is the government going to reopen? What's the path forward? I believe the answer is it is going to reopen because it did last night. So I can answer that. And there was obviously compromise legislation.
Last week.
Was it what I say?
Last night.
Recently.
Last night as of today.
As of today.
Last week as
and
of...
Mike said don't
for
do
our
that.
listeners.
Yeah, the one thing he asked you not to do.
One strike.
I'm thrown by this outline. So Mike is very unhappy. All right. Well, there goes our 5th microphone. All right. So legislation reopened the government, and obviously there's a lot of provisions in it. So what is in the bill that opened the government whenever that happened?
Well, yeah, that happened at some point.
At some point in time.
So it was a complicated political situation because since October 1, the government's shut down, and as Chet mentioned, it has impacted a lot of different types of people when they want to get access to federal lands or they want to fly to certain places. As any of you've flown the last couple of weeks and months, like a lot of flights have been canceled or delayed. But this shutdown has ended. And what it did was it reopens the government until January 30th. And right now they're still trying to figure out how they're going to pay the paychecks to a lot of these congressional staffers, FAA. There's a lot of negotiation on how they're going to get their money back. But so the government's reopens till January 30th. And then these healthcare standards Chet mentioned around telehealth and then some other things with Medicare, those were extended until January 30th as well. And then something that's a little more around Medicare is there's this thing called statutory pay-as-you-go. Basically, during the OB3 debate this summer, they spent a lot of money, and in order to compensate for the government paying this much money, they had to cut somewhere else. And so effective January 1, there's going to be a $45 billion cut to Medicare. Now, what Congress did in this bill was they waived that cut, and so the cut will not happen. But that's something that AMGA continues to follow. What is not in the bill, and what the debate was with the Democrats, and if you think about the Senate has 53 Republicans, but you need 60 votes to pass anything in the Senate. 8 senators eventually left the Democrat Party, left for that one. they didn't leave that party, but they left for
now independent.
Well, there's already 3 that already are, but they left their Democrat, King, and
2.
Yeah,
It's all good.
yeah. And
You're on a roll. Keep going.
Am I?
Yeah.
So these
No, this is fascinating.
Yeah.
I'd watch this.
So these Democrats went with the Republican Party and decided to reopen the government, but the big issue was about the Democrats wanted to extend the enhanced premium tax credit that we'll talk about later, and so that is something that still has not been addressed.
All right. So let's see, and just to sum it a little bit. So some of the extenders that you talked about, you mentioned telehealth, but also was also extended was the GPCI floor of 1.0. The hospital home program can restart again, which is important for many of our members. And there were, since the ACA was passed in 2010, Medicaid cuts to DSH providers of $8 billion a year have been delayed, and that cut was also delayed in this bill as well. So some significant short-term wins for AMG members around those extenders and the DSH payment cuts.
And we'll have to pay attention again in January 30th.
And indeed. So we will not have a break, but that's fine. And as you mentioned, in the enhanced premium tax credits were not extended as part of this compromise legislation. But Democrats were promised a vote by Majority Leader Thune. Which Alicia will get to that because that's part of the outline, which I haven't read yet. Very good. Okay,
we're on top of it today.
Yeah, indeed. I never knew how great your outlines were, Gerald. So
Just gonna let that speak for itself.
thank you. All right. So Alicia, and what were the Dems hoping to get in this government shutdown battle?
Yeah, as we touched on, the enhanced premium tax credits were a major sticking point. There was a massive holdout on the Democrats to see if they could get this extended in legislation, and it didn't happen. There was the SNAP benefits expired, or people weren't receiving SNAP benefits, they didn't expire. And so some of those Democrats moved over to vote for a continuing resolution to fund the government so that people could receive those necessary benefits. And so as a result, the holdout over the PTCs ended. And so, as you mentioned, Thune promised to vote on that. Senate Finance Committee will be holding a hearing on premium tax credits. Sorry, Jamie looked at me like he wanted to say something.
No. It's like this week, last week.
See,
when do you say it?
I didn't say a time. I just said they will be holding a hearing. It will be
Smart.
Elisa's following
the
the
week
script.
that this podcast is released. There will be a hearing on the premium tax
We're
credit.
gonna release this one.
But the premium tax credits are not going away, but the enhanced tax credit will be, which expanded the population eligible to receive the tax credits. Just for some background there, ARPA temporarily extended eligibility and increased the subsidies. The IRA, the Inflation Reduction Act, extended the expansion until 2025, and so that will they will expire at the end of this year. And 22 million people are now expected to lose healthcare coverage entirely or face major premium increases as a result.
So if these enhanced premium tax credits expire, the concern is it's going to be that much more expensive for folks to buy insurance on the Affordable Care Act exchange.
And they're going to not buy it.
And they're
Exactly.
going to not buy
They'll
it,
pay the penalty instead.
which creates problems with the risk pool. And
Yeah.
Right,
all
because the young
that.
people don't buy,
and
the older people's premiums go up even higher.
go up higher. Right. And that's downward spiral. Cats and dogs living together.
Exactly. And
Costs going up in general, premiums are going up.
then uncompensated care for our members becomes a major issue as well. All right, so the Democrats wanted these to be extended beyond December 31st of this year. They did not get that. I think the 8 Democrat senators that crossed over on this vote to vote for reopening the government, I think what they've been saying is there was a lot of hurt out there. You mentioned SNAP benefits. Obviously, federal employees were not getting paid, and that was 750,000 people. And I think, I guess the idea was that they wanted to take care of those constituents and not as much play to the base as others did. So I think that's what they're saying.
That is.
And
And I mean, Democrats are already working on their messaging for the midterms, to touch on something that I think we'll talk more about later in the podcast. But they're already looking at targeting Republicans and kind of spreading the blame for increasing healthcare prices generally, and the loss of the enhanced tax credits.
What was that number you said? 22 million?
22 million people will lose coverage entirely or face increased premiums.
Because like the Affordable Care Act, there was like 30 million at least who got access to care. So this is kind of negating all that work from 2009.
Yeah, so the
Which could impact
premium tax credits, are available to people who are at 100% to 400% of the federal poverty line. And so without the enhanced premium tax credits, it creates a subsidy cliff, as they call it. And so now if you're above 400%, just barely, you could be at 403% of the federal poverty limit, you no longer have access.
Yeah.
all right, yeah, that's a big deal. Okay. So let's talk about the immediate effect of ending the shutdown. What happens to Medicare claims and Medicaid claims now that?
Yeah, so everything's back up and running. Claims are going to get processed. And this was really confusing when the government shut down because you've got different funding streams doing different things. Like Medicare is, the actual funding is part of mandatory spending. So it wasn't subject to what was going on with the shutdown and all that. If you look at the statute, it's such sums as necessary. So the money was there. Now, the issue was, are the people to process the claims going to be there? Because that's not part of that. That's part of the discretionary budget a little bit. And with all the expiring extenders that we're talking about, telehealth, GPCI, hospital home, the concern was, are the MACs, the Medicare administrative contractors, the entities that, CMS contracts with to process all these claims, are they going to have to reprocess millions of claims to pay them accurately because the Congress reauthorized, say, telehealth? So CMS put some instructions out when the shutdown first happened. Like, we're going to put a temporary hold on these claims just so we don't have to reprocess them. Or you can hold off on filing them. You've got a year to file a claim if you're a provider. So you could just sort of sit on it and wait and see what happens. So now that we're back up and running, I expect CMS will issue some guidance on what's supposed to happen, what the MACs are supposed to do, but they're retroactively covering telehealth. They're retroactively bumping up that GPCI floor to 1. So they're retroactively extending hospital home. The flip side of that is they're extending it only to January 30th. So if I'm a provider who wants to cover telehealth, it sort of went away, and now I'm authorized again to January 30th. How does that work for my case management? How does that work in my workflows? I'm actually going to schedule appointments this way. It's causing needless confusion, which is why we've been pushing for a while for a permanent extension.
I'm curious in the hospital home, Daryl, like some people had to stop the program, and I don't know if they want to start it back or not.
I don't want to speak. Well, I guess we do speak for our members a lot, but
that's our job.
That's our job. Yeah, that's kind of what we do here. it takes a lot to run these programs, and I would be hesitant to restart a program. Here we are, middle of November, a month and a half for it to expire, and then just the confusion that's going to create with patients. You're in the hospital, you're not, you're back at home. What's the best for the patient? I have a hard time envisioning standing up a program that's going to expire in a month and a half.
Yeah, this is not the way to run a business.
No.
And very few businesses are run like this.
Yeah.
That is a problem. All right. But you mentioned that so if you provide teleservices to Medicare patients on October 2, those will be paid.
They will be paid.
There was a retroactive adjustment
right
in the bill that reopened the government.
Right. No,
that's good.
Yeah. So they likely were held, and now they'll be processed and paid as if the shutdown never happened.
Okay, fair enough. And that was one of the things that we did lobby on the past 43 days, I guess,
right,
to make sure that these things were retroactive.
Right.
So good job, Ledge team.
Thank you.
You're welcome. You're welcome.
You're welcome.
Because you speak for the members. All right. Okay, so we talked about some of the Medicare Medicaid issues. What does this do to the federal workforce? Are there more reductions in force coming? What's going on with them? Because we care about that because we live here.
Yeah, so HHS sought to lay off nearly 950 employees last month, but that reduction in force notice is expected to be rescinded. The funding law, it doesn't bring back jobs for those who were previously in layoffs earlier this year, but it does mean their severance payments will resume again. After the White House raised the possibility last month that some employees may not receive back pay after the shutdown ends, language was included in the CR to eliminate any possibility of that. So the CR instructs agencies to provide back pay as soon as possible so federal employees won't be waiting until their next scheduled paycheck to receive their back pay. That will be largely contingent on how long payment processing within those agencies and departments will be able to get that done. But air traffic controllers are expected to receive 70% of their back pay within a day or two, and the rest within a week.
That's good because I'm going to Iceland next week, so that's important.
Yeah.
And I think with the debate with the 8 senators the Democrat senators who went back and voted to open the government, there were assurances to some of these senators that we will not do any more RIFs.
So I think what I saw and read about this, is
Trump's not going to do it.
That's how they got Senator Kane's vote.
Yeah.
Right.
Who has 150,000 federal employees in his state.
From Virginia.
Yeah.
Yeah.
That's a big deal locally. All right. So they passed a bill. President signed it. We opened the government until January 3rd. So when's the next fight in Congress, and what are the issues, and what should our members be thinking about in the next 2.5 months? Is that right?
Yeah.
2.5 months.
So I think immediately our next fight is going to be January 30th, and all of the time leading up to that, we're going to be fighting because we don't just start lobbying and fighting for like telehealth extensions and all of that and hospital at home on January 30th. That's an ongoing effort that doesn't stop until it's assured. And then midterms. That's going to be a huge deal. I mentioned that Democrats are already working on their communications on that and staging this as a healthcare crisis. And I think the enhanced premium tax credits are going to play a major role in that. It was mentioned to me earlier before this podcast that Trump's pollster over summer said that Republicans are going to lose the House if premium tax credits aren't extended. So I think that's a big thing to keep our eye on, is that will change the dynamic and balance.
Yeah, and the midterms and the impact on the patients, like when you talk about telehealth, we were doing Medicaid cuts survey to our members, and they were talking about eliminating the telehealth care to their patients because they don't know about the stability of the system. And so when I talked to Hill staff about that, they were shocked. Like, how dare you? Why would you do that? And we're like, you're not paying us for the service we provide, and we can't make a plan every 3 months. And so with that being said, Daryl and the team worked on the MACRA task force report, and we'll be talking to Congress about that, the future of Medicare. But what we're trying to do is if there's anything going on in January 30th, there may be some cuts that may pay for something that we need. So AMJ will be vigilant about 340B, MA policy, and we'll also be talking about Medicaid cuts implementation because, as you call, OB3 passed last summer, but a lot of stuff is going to be happening. Some of it after the midterms, which is done on purpose. But there's still a lot going on, and you need all to be involved, and we're hopeful to facilitate all of that.
All right. So long and short, we'll be working nonstop till January 30th. And then once the 30th rolls around, then we have our larger issues around the McAfee Task Force recommendations, which are going to push as well as Medicaid cuts, which are going to happen in 27, 28. All right. So we're busy, which is good.
Super busy speaking for our members.
Well done, Mr. Trevor.
Yeah.
All right. Any final thoughts from the team?
If you want to engage, call us, email us. We do DAP, District Advocacy Program. We do Capitol Hill Day. Anything, we're here to serve you, so please reach out to us.
Yeah, reach out to us. You've got until January 30th to help us advocate on funding.
Daryl?
What they said.
What they said. All right, well
Ditto.
Yeah. All right. Well, thank you, team, and thank you to all the listeners, and I hope you all have a good day.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.